Hello, and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, August 19th. I'm Danelia Mitchum, and I will be your moderator for today's lecture, Navigating the Healthcare System. Before I present to you the wonderful speakers joining us today, I'd like to first thank Hannah Weitzman for helping with the production of this lecture, helping us manage the chat and other key aspects so that we all can have a great discussion about navigating the healthcare system, both inside the system and outside the clinic. As always, we are live streaming this lecture via our YouTube channel using the video platform Zoom, which also allows us to host a good number of people who join us via phone. Thank you so much for joining us. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to the presenters. And for those of you listening to the discussion via phone, you will also have an opportunity at the end of the presentations to unmute your audio so that you can ask your questions. We'd like to remind you that all information offered here is for general information purposes only, and to always seek additional professional advice for situations specific to you and your needs. Now, I would like to introduce our speakers. I will start with Perpetual Asim. Perpetual Asim is the Access and Quality Program Manager for the Psychotherapy Clinic within Rush University Medical Center's Department of Social Work and Community Health. In her role, she supports initiatives focused on improving access to mental health services, strengthening care coordination, and developing community-centered programs and partnerships. Perpetual also serves as co-chair of Rush Westside Anchor Mission Employee Resource Group, where she helps connect staff with opportunities to support and learn from Chicago's Westside communities. She earned her Master's of Science in Health Systems Management from Rush University. Rebecca Martinez Zarco. Rebecca Martinez Zarco is a bilingual community health worker. She joined Rush Departments of Social Work and Community Health in 2023 and currently supports the Wellness West program. In this role, she serves the Westside community and takes pride in advocating for patients who may face barriers to achieving their health goals. And welcome to both of you, and I will turn it over to Perpetua.
Thank you, Danelia. I'm so excited to be here. I'm honored to be amongst the group. So thank you so much for the warm introduction. As Danelia said, I'm Perpetual, and I'm part of the Social Work and Community Health Psychotherapy Clinic here at Rush. Today, I'll be talking about how people move through behavioral health care from inside of the system. Let me go ahead and share my screen as I have some visuals to guide our conversation today. Okay. So when I talk about behavioral health care, I want to talk about supports for things like stress, grief, worry, sadness, trauma, any major life changes, and coping with any medical or family challenges. For a lot of people, knowing that they need help is really the first step. The next question is about who do I call? What happens next? Will my insurance cover this? So today I want to make that process feel a little bit more understandable. Um, Before we get into the details, I want to make sure that what I'm sharing today is going to be practical. So for those that are here, I want to make sure that you don't need to know any medical terms. And I want to kind of give you a little bit of the behind the scenes. I want to explain in as plain a language as possible how our team helps people understand the next steps when they're looking for therapy or emotional support. But before I dive in, I just want to acknowledge that reaching out for mental health support can feel really vulnerable and scary sometimes. I know there's a lot of people that are unsure whether their concern is serious enough or they don't know what kind of help that they need. And that's why navigation and what our team does is so important. So here's what we'll cover today. First, I want to explain why behavioral health navigation is a little different than navigating other sorts of healthcare or care that you might get elsewhere. Then I want to kind of talk about how people enter our psychotherapy pathway, what our navigators do before, during, and after the intake, how insurance and access fits into the process, and how navigation continues to support someone even after their care started. So the main idea is, how does navigation help people move from being confused or being unsure to being clear on what the next steps are? By the end of our talk, my goal is to help you understand four things. First, we want to talk about the access pathway. So how does someone move from a referral or a self-referral to an intake? Second, having more of an understanding of what's the navigator's role. How do navigators help with things like insurance checks, scheduling, documentation, and communication? Third, I want to talk about behavioral health fit. So how does the intake visit help the team understand what kind of support might be a best match for what you or the patient is looking for? And lastly, we want to talk about continuity. So how does follow-up, waitlist support, and communication help keep care moving? Um, so we will start with looking at behavioral health navigation. Behavioral health can feel personal and emotional, but the pathway to getting to care involves some really practical steps. We'll start by talking about referrals, phone calls, scheduling, insurance, paperwork, and then the follow-up. First, we'll kind of zoom out by talking about what psychotherapy clinic does. So our psychotherapy clinic supports adults who may be dealing with stress, grief, trauma, worry, sadness, relationship issues, medical stress, caregiving stress, or other just challenging life dynamics. The clinic provides psychotherapy, which a lot of people also call talk therapy. Both are true, both are right. Therapy can help people talk about what they're experiencing, learn coping tools, and make a plan for moving forward. In our team, our goal is to make sure that our care is trauma-informed, strengths-based, collaborative, and patient-centered. So basically, to make it simple, we want to meet people with respect, understand what they're going through, focus on their strengths, and work with them instead of telling them what to do. So an important role of navigation is to help the patients understand what kind of care that our pathway can offer. So we'll start by talking about how patients enter the therapy pathway. So there's a few different ways that patients can get connected. First is the EPIC referral. So a rush provider can place a referral whenever you go to any medical appointments, whether that's in person or virtual. Usually the provider or their team will ask you some questions about where you are emotionally. And then from there, they'll have a conversation with you about if they think that therapy would be a good support for the things that you mentioned in that screening process. Outside of that visit, patients are also able to do a self-referral or refer yourself, and that can be through our website, or you can reach out to our navigators directly. And third is our department helpline. Our department has a lot of acronyms, but folks usually know us as SWATch. So you can call our department helpline and click on extension 2 to reach our team. And then that will connect you with our navigators by phone. So the important part is that you don't have to know every single detail. The navigators are the ones that are receiving the requests. They'll help clarify the pathway and then help you or the person move towards the next step. So instead of the patient having to figure out the system and kind of what all the steps are, the navigator is really there to help organize the process. So this is kind of giving you a glimpse of what happens behind the scenes. Once a referral is received, then we're going to go ahead and do the insurance verification. And that's helping us learn about if there's any associated costs, and whatever those costs are, those are going to be shared with you or the patient afterwards. Once we reach out to the patient and share that insurance information, at that time, we'll give you an overview of what the process looks like, where we got the referral from, and then offer an intake if you are interested. So the intake is really there to help the team understand what it is that the person needs. So from there, then there might be a treatment plan, there might be a wait list. There might be another resource that might be a better fit for what you or the patient are looking for, or you would move forward to be assigned to a therapist. So really what I want folks to take away from this slide is that the therapy process starts often before your first therapy session. A lot of the support happens before you ever really sit down with a therapist. So for the patient, it might feel like waiting or wondering what's going to happen. But for the navigation team, we're making sure that we're tracking, we're checking, we're communicating, and we're helping make sure that handoff and patient connection doesn't get lost. So I want to talk a little bit more about what the navigators do. Navigators are usually the bridge between the patient, the provider, the therapist, helping gather the insurance information, scheduling, and then any follow-up after the visit. Navigators support the therapy process in four big ways. First is the outreach. That means that whenever we do get that referral, however it comes to us, that we are calling those patients, and we're checking whether they're still interested in therapy. Some people are ready when we call them, and sometimes things have changed between the time of referral and when we're doing that call. So following the outreach or at the time of outreach is when the scheduling is offered. So the navigators can help schedule the intake visit and then they'll send a follow-up with instructions, so the patients know what to expect. Third is documentation. That means making sure that the referral, our internal tracker, notes, and wait lists are updated, so the team has the most accurate information. And last, the fourth is communication. Navigators help route updates to the referring providers, to our therapists, and to the patients. So very simply, the navigators are there to help the patients know what's happening at every step. So as I brought up before, insurance can be one of the most confusing parts of getting care. I can definitely relate as having my own insurance. Even I, knowing this process, can often get confused. So for a lot of patients, the question isn't only, can I get the appointment, but can I afford the appointment and what's my insurance going to cover? So navigators will always help verify the insurance and any benefits when needed, so the patients can have a more clear understanding of the expected costs. They can help talk about terms like the deductible, the copay, the coinsurance, and then if there's any financial counseling, if the costs are too high, that would be a time to talk about that as well. We want to make sure that we're talking about insurance early in the process, so folks have what they need to make an informed choice. So that hopefully we want to try to avoid any surprises with the bill, or any confusion about another step before care begins. So next we're moving forward, but before the intake visit, navigators help prepare both the patient and the team. So there's three main parts where the navigators are really involved here. The first part is confirmation. So they confirm any contact information, the continued interest, the type of visit, and then if there's any scheduling preferences. The second would be orienting the patient to the team. So that means we're explaining what is the purpose of the intake, if there is going to be any scheduling things that come up, what the cancellation policy is, how we use my chart or any video instruction, and then what the person can expect out of the visit. Third, we route. And so if it sounds like the person might need a different program, a higher level of care, or coordination with another team, we want to make sure that that information is communicated and routed appropriately. And one last thing that I want to clarify on this side is that the intake assessment is, it's just one step. It's not always the same thing as starting ongoing therapy right away. The intake is really designed to help the team understand what the best next step is for you or the patient. So this slide, I really wanted to talk about fit. Not every person needs the same kind of support. So some people might be a good fit for general psychotherapy, but others we find may need support that's more focused on substance use. Some people need more trauma-specific services, and some people have an urgent or a crisis concern that needs to be escalated right away. So the navigator isn't necessarily making any clinical decisions, nor are they making decisions alone, but the navigator helps get the question to the right place. So I really try to think of it as helping the patient reach the right behavioral door and not just any door. Navigation doesn't always end once the first appointment is scheduled. After the intake, the patient might be on a wait list. So even as the patient is on the wait list, we will continue that communication. And we're doing that to help confirm any interest, if availability has changed, if the insurance has been updated, and then if there's been any changes in readiness or doubts as assignment gets closer. Sometimes a therapist will transition if they have to go on leave, if there's a transfer, if there's availability. So the navigator is making sure to be in contact with the patient that whole time to explain their options and the next steps. So what support can look like in real life. So support looks different for each person. Sometimes it looks like resource navigation, such as identifying support groups or practical materials. Sometimes it looks like system advocacy, so helping coordinate documentation, any information of releases, provider documentation, or care management. And sometimes it looks like stabilizing other logistics, such as the insurance, which we talked about, if there's any transportation concerns, shelter resources, or any family crisis coordination. So those are kind of what we talk about when we say between session supports. They might not look like therapy, but they're really important to making sure that patients are able to stay engaged in therapy. And to conclude our time today, I wanted to talk about connecting our lens with patient advocacy. So inside system navigation focuses on the steps inside the healthcare system. So our referral flow, intake scheduling, insurance verification, documentation, waitlist movement, and therapist assignment. Patient advocacy focuses on barriers to care, community resources, real-world support, patient voice, and self-determination. Both of these columns are really important. Behavioral health access works best when there's two lenses, but they're working in concert. So patients, it's really important that they have a system that works, but they also need care that respects their real life, their choices, and their barriers. So to wrap our time today, I'll just close by saying it's okay to not know where to start. behavioral health care can feel confusing, but patients and their families don't have to figure out alone. If you are interested in learning more information about our team and the services that we offer, here is our phone number. This is my direct email, and then I have the link here to our website. So I really appreciate everyone's attention. Thank you so much for the time, and I'm hoping that this talk or this conversation today helped the process feel a little bit more clear and less overwhelming. I'll hand it back to Demelia.
Awesome. Thank you so much, Perpetual. And I will hand it over to Rebecca.
Can you hear me all? I think I need to be let in. I can't control the video from here. Okay. Hello, everyone. Can everyone hear me well? My name is Rebecca Martinez, and I am a community health worker here at Rush University Medical Center, working under Wellness West program, where we can help patients not only with the healthcare needs, but also with resources that can address real life barriers affecting their health. So I'm going to go ahead and go to next slide. Yes. So, as a community health worker, we basically just work with patients who qualify for our program, and we can go ahead and assess and see if they're well fit for Wellness West. So next slide, please. And if you don't mind giving me the next slide, Hannah, thank you. Okay, so patients who qualify for our program live within 10 different zip codes in the Chicago West Side area, and are managing conditions such as hypertension, diabetes, mental health disorders, and substance use. Our goal is to help patients manage their health while also identifying barriers that may basically make a following care plan difficult. And what we do here is basically assess them with an HRA, follow up with supporting medication, follow through, provide appointment reminders, connect patients with their care team, and then link them to community resources. So as I mentioned, it's 10 different zip codes in the Chicagoland area, and those are 60622, 34, 39, 51, 44, 24, 12, 42, 23, and 60608. So managing a health condition basically is not always as simple as telling someone to take medication, eat healthier, return for an appointment. A patient may have transportation problems, food insecurity, housing concerns, or may not fully understand the next step in the care plan. So those barriers can directly affect the progress. Next slide, please, Anna. So our role here as community health workers is to assess the patient's needs that may be getting in the way, basically assist with medication refills, follow through appointments, reminders, referrals, and then connections to a dietitian, nutritionist, counselor, nurses, providers, and community-based organizations. So we are all part of the care team. A provider may just prescribe or just give medication, but sometimes the patient leaves the appointment with a bunch of questions about the dosage, if it changed, and we can reinforce the care plan, help patients stay focused on the goals such as blood pressure, glucose, their A1C, nutrition, and connect them to a provider or nurse, whenever clinical clarification is needed. Next slide, Hannah, please. So we connect patients with the resources, as I mentioned, outside the clinic, which would be transportation, utility assistance, food insecurity, and employment resources if needed. We also connect patients with resources, that may need some kind of support within their community. Our involvement doesn't end after making their referral. A follow-up with the patient is what we do here basically monthly to see whether they're in track with their goal and they have their medications and completed their appointments and referrals. We assess them to see if there's anything preventing them from moving forward. And then the conversations that we provide with patients is just basically an opportunity to have with the patient that will let us know what is happening currently. If it's a need where they require some guidance or clinical assistance. So basically what we will do is connect them with the appropriate provider, as I mentioned before, or any healthcare team that is needed. Next slide, Hannah, please. So patients spend a limited of time inside the healthcare setting and the rest of their lives in the community. So community health workers help bridge those two worlds by identifying the barriers, connecting the patient with resources, reinforcing the care plan, and continuing to follow up. Next slide, Hannah, please. Thank you. So as I mentioned, inside the health system, you have care coordination, referrals, appointment, reminders. We can also assist with your insurance, connecting you to, whatever it is that you may need, clinical services, and in a patient's daily life, we also kind of connect the patient with transportation, food insecurity if they have it, housing, medication, and then follow through. Also provide them with a referral to counseling if needed and wellness resources. Next slide, Hannah. So community health workers are basically just a connection that it's a connection that we have between the patient and your provider. We will listen to understand what is actually preventing the progress. We will connect the patient and basically provide the resources and next steps so they can reach their health goal. So the follow through would be stay engaged long enough to know whether the connection worked or not. Next slide, Hannah. So if you ever want to get in touch or if you may need a referral, please reach out to either one of us. Myself, Rebecca Martinez, as a community health worker. Tiana is also working with many of our patients, as well as Jasmine. So you have our information up there. If needed, please reach out if there is any questions or any assistance needed from any community health worker. Thank you.
Awesome. Thank you so much, Rebecca and Perpetual. Very, very insightful information. I actually learned a lot. So very excited about this presentation. And we are going to actually open it up for questions. So reminder, if you are on Zoom, you can press *6 to come off of mute. If you are if you're using the chat function on YouTube or Zoom, feel free to enter in the chat as well. Okay, awesome. So some questions that has come through the chat. Does every healthcare system have navigator and community health support?
I can take this one, but Rebecca, feel free to jump in. All healthcare systems are not made the same. That is why Rush is the leader that it is. All healthcare systems do look a little bit different. Most, especially in the Illinois Medical District, are adopting and have a navigator or community health workers, but not all of them. So that's a great place to start, is maybe at the point you're entering the system, inquiring if they do have those types of supports. What do you think, Rebecca?
I agree. Not all of them are made the same.
Awesome. And Rebecca, in regards to your presentation, you made a reference to HRA. So can you tell us a little bit about that?
Of course. An HRA is a health risk assessment where we basically ask a patient several questions that will help us identify those barriers, which may include transportation to and from their medical care appointments, if they're food insecure, if they basically do not have current health coverage, we will go ahead and try to, assist the patient in having that coverage for their health at the moment. But yes.
Awesome. Thank you. And how long does CHWs work with patients? And is it an additional cost?
There is no additional cost if there is availability for a healthcare worker in the clinical setting you're at or hospital. What we do is advocate for the patient and then assist bridging the gap where it's needed. If you have a question, if your clinic or hospital may have a community health worker, I think you may ask the provider, either a medical assistant or nurse. Usually they will know if there is any community health worker on floor and connect you to one.
Awesome. And the questions are just rushing in. This is from our YouTube. If my primary care doctor is at another facility, can I take advantage of the services that you offer?
I can take that one. These are all great questions as well. Yes, you do not need to have your PCP or your primary care provider at Rush in order to get any Rush services. We find that a lot of times people prefer to keep all of their services, both medical and behavioral, at one place. But I know there's definitely cases where one place has some services you want to pursue and one place doesn't. So I know for Rush, you don't have to have your PCP here in order to get your CHW or your behavioral health services. Thanks for the question.
Awesome. Yes, Perpetual, I agree. Very great questions. And just thinking about your presentation, in general, ladies, I love how um, Rebecca, I can't completely quote what you had on your slide, but pretty much if we work together as a team, that's when things get done. So yeah, I'll go back and get that, but I think that was very important. So since you all have been in this role, wanted to just hear maybe like a general success story because as you mentioned, those barriers keeps people from getting the services that they need. Petrol mentioned, having your own insurance. I think about my own, and it's very, it's complicated. So, wanting to hear a success story from beginning to end, if you have one.
Rebecca, do you want to start? Do you have one in mind?
Go ahead, Perpetual, take it.
Great. So a large majority of our patients are Medicare and Medicaid. And often we call ourselves kind of a safety net because a lot of patients with state-funded insurance, unfortunately, don't have a lot of options. And that's just unfortunately the insurance reality that we live in. And so we're so happy to be an option for Medicare, Medicaid patients. So I have a patient that is coming to mind that recently transitioned from being on their parents' insurance to then being on Medicaid. For anyone that's ever been on Medicaid, it's a challenging process to apply. And then of course you have to go through redetermination, which is basically just every year saying whether or not you still need the Medicaid benefits. So she came to us very unsure, very like worried, having heard a lot of no's at other places that she tried to go, but we were so happy to be her first yes. We were able to share her benefits. So for Medicaid plans, they are covered at 100%. So she didn't have anything to pay for services, which was of course a relief for her. It was her first time doing therapy. She was able to do the intake, and even from the point of getting scheduled through the intake, she shared a lot of wonderful feedback about how supportive the team was, how helpful it was to feel really clear about the process prior to starting, and then to have that kind of emphasized all along the way. And I'm happy to say she's been in therapy for a couple of years now, and it's been really helpful to her relationships as she's trying to get a career and a job started. And, we know we can't keep her forever, but it's just really exciting to be able to be a support for someone that wouldn't have had supports otherwise. And to know that the therapy that she's been doing has been working really well to hit some of the goals that she came in with.
Awesome. Thank you. Rebecca, did you want to share before I go to the some of the YouTube questions?
I can, yes. So I have a patient who was identified with type 2 diabetes, and patient was just distraught. She was taking the medication without understanding if this was going to work or not. Once we assessed the patient, we connected her to a nutritionist who guided her on what benefited her to go ahead and manage her blood sugar levels. So the patient began checking her blood sugars in the morning, and she started to know what actually caused her blood sugars to be high, and what basically worked for her and what didn't. And by her just basically getting all that information from her nutritionist, speaking with her provider, and if she had any other type of barrier, she would just, come back and connect with us. And we would definitely make that, connection to who she needed to be connected to. If she felt that the medication was actually upsetting her stomach, then we would make sure that her provider was aware of that. And if this was something that was going to go ahead and, kind of work for her or not. So, answering, I think, the questions for that patient just basically brought her to have a better understanding of how she also, was able to manage and control those blood sugars. She is in a much better shape now. Like her A1C is fantastic. She feels much better. And above everything, she just feels at ease knowing that we were all there to answer all the questions she had, and she understood every step she had to take and the reason why. So I think all of that allows one to, be just content with, making that change.
Amazing, amazing, great stories. Yeah, like you said, it's so beneficial for patients to have that service in the middle, in those calls to do those trial and errors and help with that lifestyle change that will ultimately help, the A1C, mental health long term, right? So not like a short-term solution, but long term. So thank you both for sharing your stories. We also have a question in the chat. If I wanted to take advantage of your offerings, would I visit Sankofa Center? If so, what days?
I can start because we do have both the therapy and CHWs at the Sankofa Center. And so for those that aren't familiar, the Sankofa Wellness Village Center is a new center that just opened a couple months ago. It is at the corner of Madison and Killdeer, and it's a collaboration between Rush, Erie, the YMCA, and so it's really giving you a range of offerings. So we do have both therapy and the CHWs at Sankofa, like I mentioned. You don't only have to get services there. We do also have those same exact services at the main campus. So it's really about what's the best location for you, what feels most accessible to you. But the services are exactly the same at both the main campus and the main campus being on Harrison and Paulina, I should say.
Thank you. Another question, what is the typical timeline from your initial outreach to a navigator or community health worker being connected to the patient?
Yeah. Oh, go ahead, Rebecca.
Oh, sorry. So, if the referral is sent to a community health worker, typically we take about maybe 7 to 10 business days. We have to identify if the patient qualifies, specifically for Wellness West. If not, we definitely assess the patient and make sure that they're connected to the right person.
Thanks, Rebecca. And on the navigation side for behavioral services, our time to outreach is dependent on the patient's insurance status. So if you have state-funded Medicare or Medicaid, and yeah, those are like your only plans, then usually we're able to reach out within 48 hours of getting the referral. If you do have a private plan, and that includes private Medicare, then it usually takes us up to a week. We just ask for a little bit more time just so that we do have a couple days to reach out to the insurance, learn about those details, and have that information in hand when we make that outreach call.
Awesome. And then the last question we have, and maybe you can help also direct to some great resources for this, but can you share what the difference is between the deductible and the copay?
Excellent question. I'm still learning as well. So deductible, if I can break it down easily, is basically what your insurance is saying that you have to pay before they're going to start covering up to a certain percentage of the cost of services. So most people, I can use myself as a personal example, have a deductible of $2,000. So let's say I go to a doctor's appointment today and the doctor's appointment is $250. That's helping me get closer to that $2,000 deductible. So I'm going to have to just keep paying for those visits until I hit that $2,000. Now, let's say I go to a doctor's appointment today and the doctor's appointment is $2,100, then the insurance is saying I have to pay the $2,000 and then the insurance is going to pay a percentage of that $100, if that makes sense. A copay is usually 20, 50, up to $100, sometimes more, sometimes less. But a copay is basically saying that every time that you go for a behavioral health visit, this is the amount that you're going to have to pay, regardless of if you have met your deductible or not. So once you hit your out-of-pocket max, then usually the copay goes away. But regardless of if you've hit your deductible or not, you are going to be responsible for that copay if there is one. Good question. I know insurance is always so confusing, so I'm happy.
Yeah, it is. And just so the audience know, we do have a Medicare 101 lecture coming up on September 2nd. If you have any additional questions around your plans, and even if you don't have Medicare, I think it's a great lecture to attend to get some of that basic knowledge around deductibles, copays, and things of that nature. So once again, ladies, thank you so much for your presentation. Very, very insightful. And Brush Generations, thank you. And our participants, And I will go a little bit into some of the things that we have coming up. So I mentioned the Medicare, but I'll go back to that one. But we have Take Charge of Your Health. This is a free 7-week workshop for anyone age 18 and older with ongoing health conditions and their loved ones. Participants build skills to gain confidence, better manage health, and lead a more active and fulfilling life. Program includes interactive topics on goal setting, nutrition, physical activity, medication, and pain management, effective communication, and strategies for working with healthcare professionals. The next workshop will be held at our Sankofa Village Wellness Center, which was talked a little bit about today. That is 4305 West Madison Street. That is 60624. And it will be held on Tuesday, starting August 18th through September 29th from 9:30 to noon. We also have a Matter of Balance, which is a 8-week workshop for individuals who have begun restricting their physical or social activity because of a fear of falling. The workshop utilizes problem solving, confidence building, and balance improving exercise and cognitive restructuring to help participants prevent falls, improve their balance, and regain the ability to do what is most important to them. The next workshop will be held in person also at Sankofa Village Wellness Center, 4305 West Madison Street, and that is 60624. On Tuesdays and Thursdays starting October 1st through October 27th from 1 p.m. to 3 p.m. And we want to learn from you. Shaman Senior Voices aims to empower older adults to discuss what matters most to them as they age. It is important to share what matters most to you with your physician and your loved ones. Shaman Senior Voices wants to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know your goals and wishes and what matters most to you at aging.rush.edu/collaborate-and-connect. Or you can scan the QR code or give us a call for that information so that you can record on your mobile device or your smartphone. And our next lecture, which I briefly mentioned, Medicare. Our next lecture will be Medicare 101. It will be held on Wednesday, September 2nd, and that will be starting at 1 p.m. Thank you so much for joining us today. If you have any questions about the lecture or any programs discussed, please feel free to reach out to us at 1-800-757-0202. You can also follow us on Facebook at facebook.com/Rush Generations. Look forward to seeing you all in our next lecture, and thank you again for joining.